Hi, I'm Dr. Carlos Castañeda, founder of ThinkAITA. ThinkAITA is an AI therapeutic adjunct, which is a supportive companion designed to help mental health professionals care for their clients between sessions without replacing the human connection that makes therapy work. Our main product is called CAITA, which stands for Counseling AI Therapeutic Adjunct. CAITA is designed to be a bridge. It gives clients 24/7 access to evidence based tools like cognitive behavioral therapy and motivational interviewing so they can practice coping strategies, complete counseling homework, and feel supported even when they're not in session. If a client starts to show signs of a crisis, like a sudden mood shift or distressing language, SETA encourages them to seek help immediately and can notify their therapist through a privacy safe alert. Therapists never see the private chats, but they do receive summaries of usage and assessments like the PHQ-9 or GAD-7. On the provider side, we also offer AITA Scribe, which helps clinicians write SOAP notes and build treatment plans faster, saving time and reducing burnout. We're currently finishing our MVP, and university e-clinics are already lined up to pilot SETA in real-world care settings. The goal here is simple but powerful: better continuity of care. By supporting both clients and clinicians between appointments, we're helping make therapy more accessible, more consistent, and more effective. Now, I'd love to walk you through a quick preview of our platform using our current Figma prototype. Okay. So, as previously mentioned, this is our Figma prototype design for the product SETA, and that's our Counseling AI Therapeutic Adjunct. So, clinicians would have that opportunity to have the free trial. And as we previously mentioned, we're here to complement therapy and empower change, not to replace it. So, we're going to empower our clients' therapeutic journey, as well as being able to bridge that gap between sessions for their counselors and their clients. The modalities we'll be using are cognitive behavioral therapy, dialectical behavioral therapy, as well as solution focused therapy and motivational interviewing, with more professionals later being integrated into ThinkAITA. We'll also be able to add other frameworks that other clinicians may prefer, such as acceptance and commitment therapy. And as mentioned, we'll have the 24/7 crisis support, interactive homework that they can engage with SETA in between those sessions, and being able to have skill building with SETA itself. And then we can go ahead briefly to the About section. The reason why I think AITA is not SETA itself is because we're wanting to expand past the counseling field. We want to be able to help support all healthcare in in America. So we have SETA for now, which is the Counseling AI Therapeutic Adjunct. SLATA, which stands for Speech Language AI Therapeutic Adjunct, to help our speech language pathologists. RADA, to be able to support our physical and occupational therapists as well as chiropractor professionals. MEDA is helping primary care medical professionals. ABATA is to help applied behavior analysis, board certified behavior analysts. And then PATA is being able to develop and support the pediatric primary care providers and their youth in between appointments. So, as mentioned, we are hoping to expand and develop ThinkAITA to support multiple fields in the healthcare. We are just getting started and we are excited for it. So, for when diving into what it might look like as a client, SETA would help with logging in and then allow you to join into the feature. And apologies, this is the actual clinician format. So, when a clinician signs in, you're going to be able to see the page that shows the interactions that a client may have based on the summary report. You will also have the ability to um, learn from SETA what type of interventions or treatment plans might it recommend based on the appropriate modality that they are subscribed to. There's also a vacation mode in the event where a client is experiencing a crisis, but as a counselor, we can't be there all the time. So, vacation mode would allow us to share a message saying that we are not available at this moment. Please seek 988, 911, or a colleague who I have put here. So this allows counselors to preset messages if they're on vacation with a certain time and date. And when diving into what the clients see, and apologies, that was the clinicians, what the clients see are a check-in feature, ability to chat with SATA, mood tracking. SATA will ask how their mood might be today and save that data to use when having a conversation in between the sessions with the therapist clients. There's also an emergency contact feature, and here in itself is the meat of SATA when supporting the clients. The opportunity to have a chat conversation, crisis management support, as well as the situation if unfortunately a client does express a crisis. SATA would first ask if they would like to report a crisis to their counselor, and then also recommend the 988 crisis hotline. So these are some of the amazing features that we are growing and continuing to expand on for SATA. And one last thing I forgot to mention was actually in the clinician portal, we want to make sure that our subscribers are licensed providers. So we have a clinical information page where a therapist would submit their information and to make sure that we can verify, process, and ensure that not anyone can use the software. But yes, this is a little bit about SATA. We appreciate you taking the time. Thank you so much and have a wonderful day.